Now, following the alleged rape of a 15-year-old girl by a fellow patient in a psychiatric ward in a Stellenbosch hospital last year, disciplinary action was taken against medical staff. These include a doctor, a nurse, and the manager of the institution. In a scathing report by the Public Service Commission, it found that the staff flouted rules and regulations in the manner in which they handled the incident. The girl's mother is now seeking legal advice to lodge a civil claim against the hospital. Senior reporter Ayesha Ismail reports.
In September last year, this mother had a teenage daughter admitted to the Stellenbosch hospital because she tried to slit her wrists. Days later, she was informed of an incident of a sexual nature that took place between her daughter and another mental patient. Male and female patients shared a ward, but the Public Service Commission has made a number of recommendations. A security guard has also now been stationed in the corridor of the ward, and while the medical staff on duty at the time have been disciplined, the Department of Health would not elaborate on the nature of the disciplinary action.
And at the outset, I think it's important just to firstly apologize to the family for this awful incident on behalf of the Department of Health, and also to acknowledge that there are certainly weaknesses in our system and that some of the rules have not been adhered to.
The girl's mother says the system has failed her daughter again.
Apology won't bring my child's life back or give her a better life. Although money won't do it, but if I get something, I could buy a house to give her a better life, give her better education, get her help. Life is ruined, so the apology won't give her life back or make her life better.
She says while the medical staff continue with their normal lives, she has to deal with what she describes as the trauma her daughter is still experiencing.
If they did their job properly, this wouldn't happen to my child.
Karim says they have already implemented several of the recommendations made by the PSC.
Yes, so if an adolescent displays extremely disturbing behavior, what we in fact do is we put the adolescents into a seclusion room that's inside the ward, and that's also guarded by the security. So in that way, we've been able to separate the adolescents from adults that require mental health psychiatric care.
The mother says the court case against the alleged perpetrator was dropped.
They dropped the court case because they say it wasn't a rape, she was given eNCA did give permission. Although she's a minor and she's a mental patient, but they decided to drop the case because they feel it was from her side.
She says while her daughter is still receiving treatment, she has recurring nightmares and cries in her sleep. Ayesha Ismail, Stellenbosch.